Hello, my name is Alejandro Rick and I am going to talk about eosinophilic esophagitis, EOE. This assignment was sent by the teacher John Moscoso of Universidad Católica Santiago Guayaquil. Esophagitis, eosinophilic esophagitis is a chronic immune antigen-mediated disease characterized clinically by symptoms related to esophageal dysfunction and histologically by esophageal predomination inflammation. Symptoms in infants and toddlers: feeding problems, vomiting, poor weight gain and growth, reflux that does not get better with medicine; in older children, vomiting, abdominal pain, trouble swallowing, especially with solid food; reflux that does not get better with medicine; poor appetite; in adults, trouble swallowing, especially with solid food; food getting stuck in the esophagus; reflux that does not get better with medicine; heartburn, chest pain. Now we pass to a video.
What is eosinophilic esophagitis? Eosinophilic esophagitis, or EOE for short, is a type of food allergy that affects the function of the esophagus, the tube that connects the mouth and stomach. EOE occurs in both children and adults and involves severe inflammation of the esophagus, resulting in problematic function of this important part of the body. Patients with EOE can have various symptoms that can include vomiting, pain, difficulty swallowing food, and growth issues. EOE is diagnosed by examining tissue samples of the esophagus. These small pieces of tissue, called endoscopic biopsies, are collected from the esophagus wall in a short procedure called an endoscopy, where a thin tube is inserted through the mouth to look into the esophagus while the patient is under anesthesia. The collected samples are then examined under a microscope by a doctor called a pathologist, who looks for and counts a type of immune cell called an eosinophil. Eosinophils are white blood cells that are normally found circulating in the body. However, in EOE, these cells collect and build up in the esophagus. These cells cause tissue swelling, inflammation, and damage. The diagnosis of EOE is made when there are 15 or more eosinophils found per microscopic field in a biopsy. An EOE is a complex condition. It is best managed by a multidisciplinary treatment team that includes gastroenterologists, allergists, and dietitians, with all treatment decisions being made in partnership with patients and families. EOE is a chronic disorder that can flare up or go into remission, and unfortunately is a lifelong condition. EOE can be successfully managed with medicines and dietary therapies. The most common medicines used to treat EOE are called glucocorticoids, a type of steroid that counters inflammation. Dietary therapies involve avoiding the foods that cause the inflammation and disease flare-ups. Ongoing research efforts are improving diagnosis and treatments for EOE and give hope for better treatments and an eventual cure.
Now, we go to application in medicine. Treatment. Diet management may include target elimination diet, food that tests positive on allergy tests, registry are removed from diet. Elemental diet, all sources of protein are removed from the diet and the patient drinks only amino acid formula. Sometimes feeding tube may be required. Medication. Topical steroids often successful in putting EOE in remission, such as fluticasone budesonide. Acid suppressors may also have relieve reflux symptoms in some patients in combination with dietary therapy or medication. Now we pass to a video.
EOE treatment can be really complex. Although we say it's allergen driven, sometimes it's really hard to detect what the actual allergens are that are causing it. We think of allergy in the sense that you can do a blood test and find an antibody that's triggering an allergic response. But in this disorder, you don't always have that correlation. It is not classically triggered by those same antibodies that you think of someone having an allergic reaction that would get difficulty breathing or hives on their body. So treatment really can revolve around a few different areas. Number one could be diet. So even though we don't know specifically all the time what food or foods are causing the disease, we may try different diet eliminations of most common allergens that are known to affect children, to eliminate them completely from the diet and see if that helps. On the other hand, there may be people who test positive on allergen testing for hundreds of foods. And in those situations, you may opt to do what's called an elemental diet, meaning you remove all of the food proteins from the diet and you supplement them with a specific type of formula. Once you do some intervention, you may need to then go back and do an endoscopy to look for response in this inflammation. Medication treatment options are also available for EOE. Topical steroids are medications that traditionally were actually used for asthmatics. They were inhaled steroids. We use them a little differently, and instead of breathing them in, you actually swallow the medications, or you mix them in a little bit of a slurry and you take it down on a spoon in order to coat the esophagus, which is the inflamed area, and give it some relief that way. So it decreases the inflammation. They're known to work very well. But when we think about this disorder, we also have to take in mind that this is something that's considered chronic. So EOE is a chronic disorder, which means it's lifelong. And we discussed how this may be a fairly new diagnosis. So the things that are still unknown are what are the long-term effects of these type of treatment options. Topical steroids aren't the only medical therapy, but a lot of the time some significant steroids, so for example prednisone, is really reserved for when you have significant disease that may be a hospitalized child or someone who has a distinct complication from the disorder and requires it. Lastly, there's endoscopic interventions. So as a potential complication from EOE, the esophagus can become rigid or narrowed and needs to be opened up. So in certain situations where it may not respond to medical treatment, you may have to have an endoscopic intervention to expand the esophagus back to its normal size. I believe that here with the CADC and New York Presbyterian that we really care for the individual patient. We pay attention to their needs. We look at the most cutting-edge research in order to give our patients the best possible care. And that's really what we strive for on a day-to-day basis.
Now we go to advantage and disadvantages. Advantages. It's not normal. It's not mortal. Treatment is not expensive. Complications are easy to treat. Disadvantages. It's a chronic disease. Can be confused with gastroesophageal reflux. It's not an there is no specific drug for treatment. Now we pass to a new video. Now we continue. Issues that play in Ecuador. There is just one case registered about this disease in Ecuador, and it's from 2001. A treated 7 male with pyrosis regurgitation and awareness. The histopathological report of the endoscopic biopsies show eosinophilic esophagitis. The response to the treatment with esomeprazole was positive. There was another study realized simultaneously in many Latin American countries, but where they found out 2 cases of this disease in Ecuador.
Imagine getting food stuck in your esophagus all the time.
People live with that, but that's not normal.
It's called eosinophilic esophagitis, or EOE. According to Mayo Clinic's Dr. Jeffrey Alexander, it affects roughly 1 in every 2,000 people and is becoming more common.
It's probably a little more than that. We're seeing the prevalence is higher than we thought before, and we're seeing the incidence, the number of new cases discovered, appears to be significantly increasing over the past 20 years.
Dr. Alexander says it's actually a food allergy.
But over time, this disease can lead to scarring down of the esophagus and narrowing of the esophagus, and then swallowing problems become more consistent.
As Dr. Alexander and his colleagues at Mayo Clinic work to find better treatments, the question remains why EOE is becoming more common.
We don't know why. I would say allergic diseases as a whole are increasing in our society, and we don't have a good explanation for why this is occurring other than that.
For the Mayo Clinic News Network, I'm Ian Roth.
Now we continue to conclusions. It is a disease with which you can live following the diet and appropriate medicines. Being relatively new, there is no definite treatment or medication against this disease. The lack of cases in Ecuador could be because it is easy to confuse with gastroesophageal reflux. Now a final video.
So dating is a great topic of discussion for this disease, especially since with dating there's usually a food aspect involved with it. For me, for a while, especially going up to college, I didn't want to go on dates because of that reason. I thought it'd be too hard, or my date or the girl wouldn't be understanding. But I've found, as I've kind of overcome and come out and just been open, that the girl is usually pretty cool with it, and if not, then she's not good enough. For me, luckily I can have like snow cones. So like I try and find places where I can go out to eat, and that way it's more comfortable for both of us. And for me also, I try and let them know that it's okay if we go out to eat and I'm unable to eat. Like I always offer to bring the stuff that I can eat to the restaurant that you like to go to. I always try to make them feel as comfortable as possible, because if you're weird about it, then they'll feel weird. So just try and be cool with it, and they should be cool with it.
And thank you.